In this lecture, I'm going to talk on Graves' ophthalmopathy. And one of the characteristic symptoms in Graves' disease is exophthalmos, which appears in 30% of patients with Graves' disease, and it is bulging of eyeball from the eye socket, and this bulging of eyeball from the eye socket is due to inflammation, swelling, and hypertrophy behind the eyeball. And actually, Graves' ophthalmopathy, it is T-cell mediated autoimmune phenomenon that plays a role in the development of infiltrative ophthalmopathy, which is one of the characteristic symptoms in Graves' disease. Predisposing factors for the ophthalmopathy in Graves' disease are, since it is an autoimmune disorder, so factors are more than single factor. That is to say, constellation of factor. For example, environmental factor and genetic factor. There is an or it is linked to HLA-B8 and HLA-DR3. So it is not a single factor, but it is constellation of factors. Also, middle-aged female are more affected by Graves' ophthalmopathy. There are some risk factors also that may predispose to Graves' ophthalmopathy. For example, people with rheumatoid arthritis, they had 39% higher risk of Graves' disease, and people with Graves' disease, they had a 30% risk of rheumatoid arthritis. This has been actually shown in some studies. And also, one of the risk factors for getting Graves' ophthalmopathy is diabetes mellitus type 1. So the common clinical features of Graves' ophthalmopathy are lid lag, lid retraction, periorbital edema, exophthalmos, diplopia, corneal aberrations, and maybe loss of vision, but however, this is very rare and may take place in one eye, and it is due to optic nerve pressure. So the cause of the swelling in Graves' ophthalmopathy, the cause of swelling of the actually retroorbital space, there are different causes that lead to this condition, and it is due to increase in the volume of retroorbital connective tissues and extra ocular muscles. And so these are increased due to maybe 4 or more factors, but however, I am going to highlight 4 causes for that. Number 1, marked infiltration of retroorbital space. This is number 1 by mononuclear cells, predominantly T cell. As I mentioned, that it is a T cell disorder. Number 2, inflammatory edema and swelling of extraocular muscles. Number 3, accumulation of extracellular matrix components. Number 4, increased number of fatty tissues or adipocytes. So these changes displays the eyeball forward and can interfere with the function of the extraocular muscles. So now let us highlight how to treat Graves' ophthalmopathy actually from the immunological side of immunological side of view. Of course, ophthalmologists, they have their own types of treatment, but in the field of the immunology, we actually advise with some approved monoclonal antibodies. For example, Tebrotumumab. Tebrotumumab, this is a human monoclonal antibody. It is approved by FDA for the treatment of thyroid eye disease. So Tebrotumumab, now it is approved for treatment of all ophthalmopathy due to Graves in patients with thyrotoxicosis or in patients with hyperthyroidism. Also, we use corticosteroids to control inflammation. Thank you very much, Professor Ahmed Bola.